Ever ponder over how doctors analyze symptoms? It's a fascinating process. The analysis of a symptom is a complex dance of deduction, a weaving together of the threads of a patient's narrative to form a comprehensive understanding of their health condition. It's an intricate maze, an enigma that demands the highest level of attention and expertise. But don't let that intimidate you. It's also a process that can be broken down and understood in simple terms. Picture this. Each symptom is a piece of a puzzle, and the doctor's task is to put these pieces together to see the full picture. This involves a deep dive into the patient's chief complaint, an exploration of the problem's nature, understanding its effect on the patient's life and activities, identifying patterns, and even delving into the patient's lifestyle and coping abilities. In this video, we will break down this complex process into easy-to-understand steps. So let's get started and unravel the mystery that is symptom analysis. The first step in symptom analysis is understanding the patient's chief complaint. Now, what does that mean? Well, the chief complaint is essentially the main reason why the patient has decided to seek medical help. It's the primary symptom or group of symptoms that are causing concern. This might be a persistent cough, unexplained weight loss, or recurring headaches, for instance. Why is the chief complaint so crucial? It's because it forms the cornerstone of our diagnostic journey. It gives us a starting point, a hint, a clue to what might be going wrong in the patient's body. It's like the first piece of a puzzle that guides us in placing the rest of the pieces. Remember, the chief complaint is not just a symptom, it's a story. It's a narrative about the patient's health, and it's our job to listen carefully, understand it, and use it to navigate the rest of the examination and diagnostic process. The chief complaint sets the stage for the entire analysis. After understanding the chief complaint, doctors use a structured approach to analyze symptoms. This approach is akin to peeling back the layers of an onion, revealing a more in-depth understanding of the patient's condition with each subsequent layer. The first layer of this analysis involves determining the last time the patient was entirely well. This provides a benchmark, a point of reference from which we can trace the onset and progression of the current problem. Next, we delve into the character of the problem. Is it a sharp, stabbing pain or a dull, aching sensation? Maybe it's a persistent cough or an irregular heartbeat. Each symptom has its own character, and understanding this can provide valuable clues to the underlying condition. The third layer of analysis involves looking at the effect of the problem on other systems and activities. Does the symptom exacerbate when the patient engages in certain activities or at specific times of the day? Does it affect other bodily systems or functions? These details can help pinpoint the nature of the problem and guide the next steps of the investigation. The nature of the problem's onset is another crucial aspect of the analysis. Did the problem start suddenly, or was it more gradual? This information can be instrumental in differentiating between various conditions. We also consider the patient's hunch of what might have precipitated the problem. Although not always accurate, patients' insights into their own health can sometimes shed light on factors that medical professionals might overlook. The course of the problem is examined next. Has the problem been steady, or has it been waxing and waning? The pattern of symptoms over time can provide valuable information about the nature of the illness. Remember, this approach is not a one-size-fits-all solution. It's tailored to each patient, taking into account their unique circumstances and experiences. The goal is to gather as much data as possible to form a comprehensive picture of the patient's health. This structured approach ensures that no detail is missed. It's a methodical process, designed to leave no stone unturned in the quest for accurate diagnosis and effective treatment. Now that we've got the basics, it's time to dive deeper into the nature of the problem. The onset of a problem can often give us a clue about its nature. Was it sudden or gradual? A sudden onset might suggest an acute condition, such as a heart attack or stroke, while a gradual onset could indicate a chronic disease like diabetes or arthritis. It's like being a detective, where every detail can lead us closer to the truth. Next, we turn to the patient's hunch of precipitating factors. These are the events or conditions that the patient believes may have triggered the problem. For instance, a patient might associate their persistent cough with a recent house renovation, suggesting they could have inhaled something harmful. Or someone might link their stomach pain to a new medication they started taking. It's important to remember that these are just hunches, not definite causes, but they can provide valuable leads for further investigation. Now let's talk about the course of the problem. This involves how the problem has progressed since it began. Has it gotten better, worse, or stayed the same? Does it follow a pattern, like worsening at night or after meals? This information can help us understand the nature of the problem. For example, symptoms that improve with rest and worsen with activity might indicate a heart condition. It's also useful to consider the frequency and duration of the symptoms. Are they constant or do they come and go? How long do they last? A headache that lasts for days is different from one that comes and goes in a matter of minutes. Remember, every patient's experience is unique. What might seem like a minor detail to one person could be a major clue for us. So it's vital to listen carefully and ask thoughtful questions. We're not just collecting information, we're building a story, a narrative that helps us understand not just what's happening, but why it's happening. And the more complete our story, the better our chances of finding an effective treatment. Understanding the problem in depth is crucial for accurate diagnosis and treatment. Once the nature of the problem is understood, it's time to locate it. Locating the problem is a critical step in symptom analysis. It involves pinpointing the exact area where the discomfort, pain, or abnormality is occurring. This is often done through physical examination, imaging studies like X-rays, MRIs, or CT scans, and sometimes through exploratory procedures. The goal is not just to identify the location, but also to understand how it's affecting the body as a whole. Think of it like a detective story. The body is giving us clues through symptoms, and it's up to the medical professionals to piece them together and find out where the problem lies. A headache, for instance, might be caused by tension in the neck, sinus congestion, or even an issue in the stomach. The exact location of the problem can drastically change the treatment approach. It's also crucial to understand how the problem is affecting other systems and activities. For instance, a problem in the digestive system might also be affecting the person's energy levels, mood, and appetite. Or a chronic pain in the back might be disrupting sleep and causing fatigue. By understanding these connections, doctors can assess the severity of the problem and the ripple effects it's having on the patient's life. Another important aspect is understanding if the problem is localized or if it's spread to other parts of the body. This can be particularly important in cases like cancer, where the disease can metastasize or spread from its original location to other parts of the body. Remember, each patient's body is a complex system of interconnected parts. Any problem, no matter how small or localized, can have wide-ranging effects. And so, pinpointing the location of the problem is not just about finding where it hurts, but understanding the full impact on the patient's health and well-being. Locating the problem helps doctors target their treatment. It's like turning on a flashlight in a dark room. Once you know exactly where the problem is, you can shine a light on it and start working towards a solution. After locating the problem, doctors look for patterns. Patterns, you see, are like the secret language of symptoms. They're the subtle signs that help medical professionals decipher what might be happening underneath the surface. In the world of symptom analysis, recognizing patterns is akin to decoding a complex cipher. It's not just about what's happening, but when and how often it's happening. These patterns can reveal a wealth of information about the potential causes and effects of a patient's ailment. Consider the case of a headache. Is it a relentless daily occurrence, or does it come and go at certain times? Is it more pronounced in the morning or in the evening? Does it coincide with specific activities or situations such as reading, working on a computer, or being in a noisy environment? These patterns might suggest different causes: tension headaches, migraines, sinusitis, or even eye strain. Patterns can also help identify more serious conditions. For example, chest pain that occurs during physical exertion but eases with rest could indicate angina, a symptom of heart disease. On the other hand, chest pain that's constant or random might suggest another underlying issue. These patterns provide valuable clues not only about the nature of the problem, but also about its severity and potential implications. It's like piecing together a jigsaw puzzle, where each piece adds to the bigger picture of a patient's health. However, it's crucial to remember that while patterns provide important insights, they are not definitive diagnoses. Our bodies are complex, and symptoms often overlap between different conditions. That's why it's essential to view these patterns as part of a broader context in the symptom analysis process. In conclusion, identifying patterns is an integral part of symptom analysis. It's a way for doctors to delve deeper to find the connections that might otherwise be overlooked. It's about understanding the language of symptoms and translating it into potential causes and treatments. Identifying patterns can provide valuable clues about a patient's condition. Once patterns have been identified, doctors consider the patient's efforts to treat the problem. The journey of symptom analysis does not end when we identify the patterns. Instead, it takes another interesting turn, where we delve into the patient's own attempts at treating the issue. These personal efforts can often be the key that unlocks a deeper understanding of the severity and impact of the condition. Consider a patient who experiences frequent headaches. If they've tried over-the-counter medications, increased hydration, and even changed their diet without any relief, it suggests that the problem might be more serious than a simple tension headache. The persistence of symptoms despite these efforts could hint at underlying conditions like migraines or cluster headaches. On the flip side, if a patient with the same symptom finds relief by simply drinking more water, it may indicate that their headaches were due to dehydration. In this case, the effectiveness of the patient's treatment efforts helps the doctors understand the root cause and potentially avoid unnecessary tests or treatments. Moreover, understanding a patient's treatment efforts also provides insight into how the condition is affecting their daily life. If a person is willing to make significant lifestyle changes, try multiple medications, or even seek alternative therapies to manage their symptoms, it's evident that the issue is having a substantial impact on their quality of life. These efforts can also shed light on the patient's mindset and their determination to get better. It shows their willingness to take an active role in their healthcare, which can be a crucial factor in their recovery process. So, when doctors consider a patient's treatment efforts, they're not just looking at what was done. They're gaining a comprehensive understanding of the symptom's severity, the patient's response to different interventions, how the condition is affecting their life, and their attitude towards their health. Treatment efforts are an important part of the symptom analysis process. It is a piece of the puzzle that helps paint a complete picture of the patient's health journey, leading to a more accurate diagnosis and a more effective treatment plan. The final step in symptom analysis is understanding the patient's lifestyle and coping ability. This isn't just a final checkbox to tick off. No, it's a crucial aspect that can significantly influence the course of treatment and its success. So why is understanding a patient's lifestyle so important? Well, lifestyle factors can often be the root cause or a significant contributor to the symptoms a patient is experiencing. From the food they eat, their level of physical activity, their sleep patterns, to their stress management strategies. All these elements can play a vital role in the manifestation of symptoms. For instance, a patient with persistent headaches might be experiencing them due to excessive caffeine intake or chronic sleep deprivation. Similarly, persistent lower back pain could be linked to a sedentary lifestyle or poor posture at work. By digging into these lifestyle aspects, we can offer suggestions for lifestyle changes that might alleviate the symptoms or even resolve the problem entirely. But it's not just about identifying the lifestyle factors. It's also about understanding how capable the patient is of making necessary changes. This is where the patient's coping ability comes into the picture. It's essential to gauge how well a patient can manage stress, adapt to change, and cope with adversity. A patient's coping ability can affect their willingness and capacity to implement lifestyle changes, adhere to treatment plans, and manage their symptoms. It can also influence their resilience in the face of a chronic illness. For example, a patient with strong coping skills may be better equipped to manage the psychological impact of a long-term condition, leading to improved overall well-being. By taking the time to understand these factors, healthcare professionals can tailor their treatment plans to the individual. They can provide the necessary support, suggest realistic lifestyle changes, and help the patient develop better coping strategies. It's about treating the person as a whole, not just the symptom or the disease. In essence, it's not just about what's happening in the body. It's about the person living in that body, their habits, their strengths, their struggles. understanding a patient's lifestyle and coping ability can help doctors provide the best possible care. So, that's how doctors analyze symptoms. It's a complex process, but one that is crucial for accurate diagnosis and treatment. We've journeyed through this process together, starting with the chief complaint, diving deep into the patient's history, and understanding the nature of the problem. We've learned how crucial it is to pinpoint the location of the problem and identify any patterns that might be present. We've also seen how important it is to explore any efforts that have been made to treat the symptom and how these efforts can provide valuable clues. Lastly, we delved into the patient's lifestyle and coping ability, reminding us that medicine isn't just about the physical, it's about the whole person. Each of these steps, from initial complaint to in-depth lifestyle exploration, plays a vital role in accurate symptom analysis. Remember, each step in this process is crucial for ensuring the best possible care for patients. Thanks for watching.